Chronic cough, causes and treatments. Chronic cough, lasting for more than 8 weeks, can stem from various underlying causes. Common culprits include postnasal drip, gastroesophageal reflux disease, GERD, asthma, and smoking-related conditions. Treatments may involve addressing the underlying condition, lifestyle modifications, and medications such as antacids or inhalers. In some cases, a multidisciplinary approach with input from pulmonologists, allergists, and gastroenterologists may be necessary for comprehensive management. Book your appointment at ENT Care and General Hospital.